Okay, so this is our fourth panel. Okay, so this is panel number 4. And just as always, so folks understand what we're doing, myself and Councilwoman Joy Moss are on this task force, and we're gathering information as it relates to the impacts of homelessness, and in particular homeless encampments in our community. But we're trying to get an understanding of the challenges around homelessness, not only with our city, but kind of from a broader perspective with the county and some of their partners. So we've had regular panels, we've got different agencies like Contra Costa Fire Department. Who else could we get? 4 teams.
4 teams, Tri-Delta.
4 teams, Tri-Delta Transit, and so we're just kind of understanding what these impacts look like every day. And so this panel is specifically titled Meeting Basic Needs, from education to housing to medical services. And so this should help us kind of understand a little better what it is to literally be living on the streets in the types of medical services that exist, where people go, and then how it looks like from our K-12 perspective, and then our community college district level. I know we're experiencing a lot of students who are facing homelessness. And then Sutter Health is here because, as the assistant fire chief mentioned earlier, when they respond to calls for services, and these are individuals who are these are residents who are unhoused, a large portion of them go to Sutter Health, so they're impacted as well. So we're going to start with one of our favorite people, Lisa Perry from the Antioch Unified School District.
Hi, I'm not a fan of public speaking. I like helping, but not necessarily talking for everyone, so bear with me. I am relatively new in this position. I am a homeless liaison, student field assistant for Antioch Unified School District. So what that means is I am the person that helps support the students and their families who are considered homeless that attend school in our district. So for us, I am what they also call the McKinney-Vento liaison, and every district in the country is required to have someone designated as a liaison for the McKinney-Vento law. I don't know if we're showing this slideshow. So the focus of the law is to make sure that students who are in a transitional housing or homeless situation, that could be doubled up with other families, tripled up, living unsheltered in cars, wherever, temporary shelters, hotels, motels, those types of situations, do not have any barriers to attending school. So that means help with enrollment if they need it. As anyone that has kids know, when you go to enroll your kids in school the first time, there are certain documents that are required, and some of those are address verification. Obviously, a family who is not in a permanent housing situation is not going to have those things, but that should not prevent a student from attending school. Same thing with birth certificates, immunization records. Sometimes those things get lost when a family is evicted or has a fire or some other, personal situation. They may not have access to those documents immediately, and we don't want to see kids sitting out of school because their family is not able to provide those things due to their big situation. So that's where I step in, and if there is an issue with the school or the parent is afraid to even approach the school because they don't have the documents, they may go on the website and see what's required and see, I don't have those things, I can't put my kids in school. I'm there to help them, walk them through that process, get them enrolled, and then I also extend those services out to reach out to the county or wherever documents that are needed. Eventually, they do need to be provided to the school, so we'll try to help them either get them or direct them to the right place where they can get those the documents and things they need to get kids in school and to keep them going to school. So one of the other things that we provide through the district, through federal funding, the Title I funding, is help with transportation for those families. And that can be in the form of bus tickets, allow the older kids to take the bus. I am able to purchase bus passes for Tri-Delta and get those kids passes to make sure they are going to school every day. And also gas cards, families that have a vehicle, This is more younger kids that obviously you don't want to put them on a city bus, help them with their transportation costs strictly to and from school. In addition to that, I provide jackets, school supplies, backpacks, anything that might hinder or make more difficult a student attending school. That's the main focus of what I do. Unfortunately, people hear homeless liaison and they immediately think I can find them housing, and I wish I could, but we all know how difficult that is, especially in California and this county. I have resources for them, and I can get them directed to where they need to go to make sure that they're on waiting lists, if they qualify for, county funded housing or other things like that. I definitely will go above and beyond to help them, but I do not actually find housing for our families. We're getting that.
It's up, I think.
Oh. Probably skip through the first couple. Just to give you some demographics of how many families we do serve. The majority of families are doubled or tripled up, so that means they are living with friends, family, possibly couch surfing, bouncing around. We have a lot of older students in high school, 17, 18, 19, trying to finish up graduate high school for various reasons. They are out on their own. And as many of us know, even families, it's difficult to find housing. So imagine a 17, 18-year-old who is still attending school is not going to be able to, pay for housing for themselves. So they are often out on their own and bouncing around, staying with friends, and oftentimes those situations are not very stable. They're jumping around place to place. Those are kind of the kids that have my heart the most. It's my first year in the job. I had no idea we had that many students that were not living with their parents for various reasons, and they're really missing out on a lot of support, which makes it really difficult for them to attend school regularly and succeed in school. So I really have a kind of a big heart for those kids. We have, at any given time this past school year, we've got about 350 to 400 students and their families, but without families, who are considered homeless. And like I said, that's double, triple up, in shelters, living in car garages, temporary shelters, hotels, and motels.
I think we're up, Lisa. Finally, sorry.
Here.
Do you want to skip ahead? Where do you?
There. That's done. It's really not over yet. Making evento, like I said, is the law that provides for the students. And just some of the things that I do, if anyone's interested, what my job is on a day-to-day is identifying students. That can be difficult. A lot of families don't necessarily want to step up and tell a school that their family is homeless. Some of them are worried. They think that their kids can be taken away because they're homeless, which of course is not, being homeless is not against the law. There's absolutely no CFS involvement unless there's a safety issue for the student or some abuse or something like that, not for being homeless. You can go back. I provide services, supplies, resources, monitor attendance. One of the requirements of the transportation help is that they are actually getting the kids to school. So if I'm giving out bus passes or gas cards and the kids are not coming to school, that's an issue because that's what I'm providing those things for. Working with the school sites to help support students and identify the students. Providing education to the staff at the school sites. There's a lot of stigma behind the word homeless. I think that was mentioned before. I'm sometimes uncomfortable even saying that to families because they may not consider themselves in that situation, especially if they're doubled up. So I like to say transitional housing situation is not perfectly stable. And that again kind of prohibits some of the families from sharing their situations. I also work with a lot of accounting agencies, nonprofit organizations, churches, food banks to help direct our families, and sometimes even pick up items and get them to families that need them. Also work with the County Office of Ed with training, seminars, just gathering more knowledge in ways that we can reach out, connect with the families, and help those kids go to school and be successful. All of our funding comes from the federal government. There's limitations on how we can use the money. It has to be directly related to attending school, so we're not actually allowed to buy food, housing costs, things like that are not things that we can use the money on. Now donations, anything I get donations on, I can use it however the family needs. So I do a lot of help at the holidays with toy drives. I work with the Antioch High School for one for the holidays. We adopt families. We have a giving tree at the district office for students. And a lot of families could use help with things that I'm not able to spend money on. So if I do get donations, I'd like to do it, gift cards, Target, Walmart, things like that, where they can go in and get a variety of items for their families that help them offset other costs that they're dealing with. And then supports that we have in the district, the Liaison, which is me, to help families navigate any barriers that might keep students out of school, help advocate for the students and families. We have counselors at all of our school sites. They are a key link for me in connecting with the families. Often counselors are working with the students, and probably the majority of the referrals I get are from counselors at the school sites, letting me know about a particular family or student that they're concerned about, and then I will reach out to them. Also, our administrators, office staff, just keeping everybody educated and kind of ears open and eyes open on those families that might be struggling that haven't stepped forward. And then I also attend all the STAR hearings. Those are the Student Attendance Review Board. So when a child is considered truant, there are times when those families are homeless, and part of the reason why they are having difficulty is because of transportation, or they may have temporarily moved out of the area, so they're having a harder time getting their kids in school.
Thank you, ma'am.
Thank you, Lisa.
Good afternoon. My name is Aiello, and I am the director of East Bay Men's Recovery Center. We're located right up the street here on 6th and F. We are a nonprofit, faith-based men's recovery center, and currently we have 2 homes that we house anywhere between 6 to 12 men. However, at some point, we would like to expand that to house women as well at some point. So what we do is we help men. We know that the homeless situation out here in Antioch is not just, the drug, the addiction, but it's a lot of different things that are causing it. But I know a lot of them, is because of the addiction. I know firsthand because I am a recovering addict, and I too once was homeless out here on these streets. And what got me basically straight and narrow is the program that I'm now running. I came into in 2012, and I was a student here, and this program basically saved my life. I don't know what I would have done without it. And on Saturdays, we feed our church, we feed the homeless. A lot of the people that are running the streets come into our church on Saturdays, and we see them firsthand, and we're able to, to minister to them and give them blankets and, just talk to them. We've had a few come in through our program, and a couple of them made it. A couple of them, we see back on the streets again. Sometimes it's a revolving door, and it's a little, frustrating, but, we plant that seed. There's a seed that's planted in them, and, we can just do our part. So we help them with the guys that come in the program, we help them get their GED. We also have other resources, aftercare program, Rubicon. I work with Hector and Health Right 360 to do reentry, and also Fast Days over there on Live Oak. We work with them. We send some of our students over to his program to help them get, get licensed as mechanical engineer, or not mechanical engineer, I'm sorry, automotive engineering. And so we, again, we want to be a part of the solution, and I think treatment is a huge part. It would be nice if Antioch had a detox center, because there's no detox center on this side of the hill. There's no closest one in Concord. We can get these guys in detox and get into treatment. I think it might make a difference. There's a lot of guys that come in on Saturday that we talking about want help, and a lot of them, it's hard for them to take that first step. It was hard for me to take that first step, but once I did, the reward was great. And basically a lot of these guys, a lot of these people out there, they need help. They're hurting from something, whether it be family issues or whatever the case may be. They need healing. They need to be loved on. They need to know that somebody cares about them. And so like I said, moving forward, it'd be great if we could. We don't get just another side note. We don't get no funding from the state or from the county. We generate all of our revenue to keep the doors open, and sometimes it's really tough to do that. But we manage. We believe in a God that gets us through it. There's many recipes for recovery. The one we see work quite often is having a relationship with God, and not only that, but we send the guys to Celebrate Recovery. They do 12 steps. It's basically a spiritual journey, is what it is what it boils down to. Whether it's you believe in God or not, it is a spiritual journey. Again, the 12 steps, we're high on that, and we take them to different outreach programs and stuff. So it's pretty rewarding. It's great to be able to know that. I once was out there. I was once running the streets with a lot of these guys that are still out there doing it. And for me to come up, out of it, and now to get back to the community, it's a really rewarding feeling. I would just like to see more resources towards, the treatment part. So, thank you.
Good afternoon, my name is Valentino, and I'm one of the care coordination managers at Sutter Delta, right here on Longshore. And so what my department does is we provide social services within the hospital, and then we also provide discharge planning for pretty much every patient that needs to reintegrate back into the community. So our homeless epidemic that's developed in Antioch has definitely grown over the last 15 years. Many of us grew up out here. I grew up in Pittsburgh, in Antioch, so I'm able to see firsthand the transition that has happened to our community. I'm blessed to be in a position to be able to do this work, but we definitely need more services and more help from everyone within the community. We see pretty much the full gamut at the hospital. There's a slide deck that I usually use, and I start off with a bunch of different pictures, and those pictures range from children all the way up to our elderly adults. And all of these different individuals are homeless in some form of fashion. Whether it's mental health, whether it's substance abuse, whether it's a parent that missed one or two paychecks. The problem has grown so vast, and we're really trying to place Band-Aids on the different scenarios that we see. And we just really need more resources and need this to be brought to the leaders in our community so that they can understand the issues that our families are dealing with. Something that just rolled out this year, I believe it was January 1st it rolled out, was the legislation SB 1152. That will change because SB 11 will be recycled, but for now, SB 1152 is a requirement for hospitals to produce better discharge plans for our homeless patient population. It started down in Southern California. It made the news 60 Minutes, where there was, kind of a horrific scene of one of our elderly homeless patients walking down the street with her gown on backwards, right? And then there was another situation in Sacramento, and then that kind of just sparked headlines all throughout America. So now hospitals are being asked to provide better plans in place for these patients when they discharge, clothing, appropriate weather clothing, food or a meal before they leave, transportation before they leave, or to their destination. And then, of course, different clinical checkpoints, vaccines, access to medication, those things. So those are some of the things that we are being mandated to put in place at hospitals. But with or without that mandate, we were already trying our best to provide these services for many of our patients. One of the things that Antioch in Pittsburgh is also seeing is us being one of the last stops for BART. So now you have a door or access to a lot of homeless individuals that are transient. And oftentimes what happens is they'll ride the BART so that they can have a form of shelter during the day or night. But then, when it's the last stop, they're forced to get off. So many of the times they're forced to get off, something happened at our emergency room. So now we're not only working with our homeless patient population that actually live here in Antioch, we're also working with Oakland, we're working with Richmond, we're working with San Francisco, we're working with Millbrae, wherever it is that they came from. So not only do we need more resources in our community, we need to know these resources and have the ability to get them safely back to their own communities, because they do belong to these communities, and they'll let you know that. The other part of this is that they're one of our most marginalized patient populations. They're going to become sick, right? So now, what does that discharge plan look like when you're trying to put together a safe discharge plan? These patients need to go to skilled nursing facilities. These patients need to go be transferred to other hospitals. They need to go to medical rescue shelters. But you need the additional resources to be able to make that happen. At Sutter, we've done a lot of partnership with Philip Dorn, our medical rescue placement, but there's only one, right? And if you have every case manager from Sutter, Antioch, and John Muir all fighting for the same bed, it's not enough resources. Core outreach team has been a huge blessing for our facilities, but there's only so much that they can do. And then the other partnership that we've tapped into has been the BART clinic, in which we're working with our homeless patients, not even homeless patients, but just patients on methadone maintenance in general that also need additional resources when they discharge. And because of the circumstances, a lot of those patients fall into the homeless category as well. So that's just kind of a brief overview of what we're working on here in Antioch. I can tell you some very soft numbers. When we started this SB 1152 rollout, in 2018, and when I say these numbers are soft, they're extremely soft. I think we've seen 900 homeless patients in our emergency room in 2018, and then another 200 plus were admitted. So that's a total of 1,100 some patients, homeless patients, right here in Antioch. And that was before we had a tracking system. So now, once we have our tracking system in place, those numbers are definitely going to jump up. So,
Thank you.
thank you.
We're going to have follow-up questions, so we'll come back to that as numbers.
Good afternoon, my name is Gage. I'm a program coordinator at Medanos College. I work with student success and retention. And at our campus, students who are experiencing houselessness and homelessness have grown. Most of our students are self-identified through our foster youth program called Bravo Scholars or through their financial aid application that they fill out every year. And since fall 2018, 30 of our students have applied and enrolled but had to drop out due to housing insecurities. So LMC is actually just now in the planning stages of starting a program to deal with students who are experiencing houselessness and homelessness. I will be joining the homelessness liaison group for our campus, but for the most part, our program is going to mirror what the foster youth program looks like, and that includes everything from providing supplies, priority registration, making sure that students have what they need so that we can alleviate some of the obstacles that they go through. In addition, we're going to be working with our athletics department to provide access to showers before and after the regular school day so that students who are living on campus, we're also working on designated parking for students who are living in their cars to have a place to come and shower, because research has shown us that if a student isn't confident in their physical appearance, they're not going to attend classes, and that affects both the student as well as the campus. Again, because we are in the early planning stages right now, our campus is really more so referring to programs that assist our students with finding housing. Because like Lisa mentioned, when they hear, oh, you work with homelessness, the first thing they want to assume is that we provide housing, but in fact, we just provide resources for housing. We are also working with our students so that the county is right next door. So a lot of the resources that we have with our other programs, we're trying to spread out as much as possible to include houselessness and homelessness students, because as mentioned, they are the marginalized population. And when they get on campus, while the campus's main priority is that they are students first, the students' main priority is their personal life and making sure that they have a safe place to reside at night. So we want to make sure that when working with students, we understand, yeah, you want to come, you want to get a certificate or a degree, but you also have other problems that might be prioritized in their own life. So I have the benefit of starting up the program that we plan to launch in 2020. Right now, I currently have 4 students who are in our fostering program who identify as houselessness and homelessness. And thanks to the John Burton Advocates for Youth, as well as a program called Spark Initiative through Youth Center Voices, those students have been temporarily housed and will remain housed through the completion of their degree.
Okay, so we're going to allow for, I'm still taking in everything he says, especially you, in regards to students and then the impacts at the hospital, and then, so we're all learning through this together, and I'm constantly blown away by the things I'm hearing. But I'm more blown away by the fact that Los Medanos has actually embraced this and said, enough is enough, we're just going to deal with it ourselves. And somewhat, is what sparked kind of this conversation, because at some point we can all keep pointing fingers and say, well, it's the county's responsibility, it's their responsibility. They're on our streets, they're our problem. And so with that, we'll open it up to question and answers, and we'll start with Joy.
Thank you all for coming today. Everything you all said is incredibly valuable. So Lisa, I just kind of want to get back to you, because we're a school board member, and just passionate about students. So you said 350 to 400 that you have this year, correct? are homeless, unsheltered, or couch surfing, or so is there a process that you go through to follow up with them to make sure that they're still, they're going to school? Is there somebody at school that's telling you that, when somebody's not showing up? And so just if you could explain that a little.
So initially, if they are interested in services, first what we do is we try to get every student in the entire district to fill out something that we call residential status. It's something that goes home to everyone, so it's not selected to any particular person or family. And it just asks them to identify and have some choices on what their living situation is. So anyone that is other than permanent housing, there's 4 codes that we use, the ones that I mentioned before, those forms will come to me. Students will, that's how we'll get the student initially have. Now, not everybody that marks that off necessarily considers themselves homeless, because sometimes they're doubled up, even though it may not be by choice, they may not feel that they need anything. They're working on what they need, they have some support. So sometimes I will call someone and they don't need anything, they're not homeless, and it's self-aid, so we don't do any type of investigation, we don't visit anything like that. If family feels that they're in that situation, we have to trust that that's where they're at right there and provide services. So it's not a lot of questions. Same with the teens that are on their own. To me, it doesn't matter why they're not living with their families anymore, whether they were kicked out, they chose to leave, what their situation is. Bottom line is they are on their own and we need that extra support. So we have the students tagged, so that gives me a database to work with, and then we also have a form that we call a homeless intake form. That's what we came into a homeless intake form. That's in a little more detail. That's voluntary, but I try to work with the school sites to offer that to families when they're new families enrolling or a situation comes to where a parent comes in and lets the family know, or sometimes it's a student that lets a counselor know or a teacher what the situation is. And I will then reach out to the family and find out if they're interested in services. Because sometimes they're not, and more often they are, but I do sometimes encounter families that are not interested. And they kind of become mine. Once, I meet with them the first time, then there's some continuing services that I'll provide them, that's transportation. They always have all my contact information, so even if it's a one-time need, they're doing okay, they need a little extra help, they need some resources, they always know anytime they need to get in touch with me. If they lose my number, they can just go to the school. Everybody knows who I am. I send a lot of communication out to all the sites, to the administrators. I was a secretary for over 15 years, so I try to understand how it works at the school site when someone comes in. So I'm always reaching out to the secretaries of the sites, the counselors, to make sure that they know I'm always available. And I think that helped a lot this year. It's been my first year, like I said, to work communicating with the schools, just putting myself out there. I go to the schools, I meet with parents, whatever works with them. They come to my office. If they need to use my computer, if they need to apply for housing, they don't have access, or food stamps, whatever it is, they're not very good services, I'm always open to have them come do that for my office. And a lot of the kids that are transitioning to any teens around their own, I will help them with that. A lot of them are not aware that they have services like that available to them.
My question is specifically for you, Andy. I know something about your program that I don't think everybody else knows, and that's the timeline for a client to be in your facility. Can you talk a little bit about that?
Yeah, so it's usually, it's a 12 to 18 month program. We offer them it's a 1 year program, and we offer them like an internship, from then on, and then from there, we transition them into a school living house that we have, and from there they go out, get a job, and basically try to, live life on life terms, get back on their feet. And we partnered with Shelter Aid with that, which is really, really good. They've been a blessing. But yeah, so like there's different steps that they go through. Like the first 3 months, they have like a 30-day blackout, you know, to where we evaluate them, they have no contact with outside. Basically, just kind of get them their foot grounded, their feet grounded, so they're not thinking about what's happening on the outside. And then from there, the first 3 months is like their initiation evaluation period, and then they get passes and they go forward, 6 months, and they get evaluated, they have curriculum and stuff that they need to do, different assignments and stuff like that, and we evaluate them throughout the year, and then at the end of the year, when they graduate, they move them on.
Yes, sir, you have a question.
Well, I'd just like to add.
Oh, no,
I'm the executive director of the program. I'd just like to add that I see you going through that. After they've been in 9 months is when we start working with Rubicon and helping them make decisions on employment and that sort of thing, so they do have employment. And we give them more flexibility in that last 3 months to apply for jobs and different things so that they're ready to go at the end of that 12 months. So we're not just turning them back out on the street. And we do have the SLE where they can go and live for up to another year, or longer if they need it, as long as they are being productive and they're showing that they're keeping themselves clean and that sort of thing.
come on up here. While you come up here, I'll just say that I found that interesting because we keep talking about shelter, and we only have one here in Antioch, closed down, I believe, first. And it's for the severely mentally ill and those who are experiencing affectation. It's like a 30-day period. But your program is interesting in that there's a reality, which is people don't just recover over a 30 or 60-day period. It's a long process. And so that's why I wanted that help to be here today, because we have to really talk about how we deal with the various challenges that associated with people who are not.
My question is for Anthony, because I think the people that he's working with are the people who are the real causing the problems in the community. The people who are homeless that are going to schools, they're not going out stealing stuff and ripping things down and making a mess. But the people, the substance abusers in Antioch, they're causing a lot of the problem. And I won't say I'm an expert on this, but I've been doing a lot of research, and my question for you is, how best get people into your program and be successful? Because I've seen 2 different paths. My daughter worked for Larkin Street Youth in San Francisco, and my sister worked with something, and they work with things that, you're homeless, you come in, you get your food, you get your shower, they take care of you, and they try to befriend you, and after you get their trust, and the homeless trust in them, then the homeless will say, hey, can you get me rehab, can you get me housing, and it goes that way. On the other hand, I talk to a lot of people recovering addicts, and they claim the only time that they seek rehab was when they hit rock bottom. As long as people were giving them food, giving them showers, taking care of them, they were living the life. So in your estimation, and so in some sense, I say, don't give them anything. Let's see them to rock bottom so they'll go to your program and get fixed. In your estimation, what's the best way to get them into your program?
It's an easy question.
Well, speaking from experience, I hit rock bottom. Okay, I hit rock bottom. My family wanted nothing to do with me. I was walking around the street wearing out with a backpack and nowhere to go. And I made a conscious decision to turn my will and life over to God. That's basically what it boils down to. It's it's a decision that they have to make. We can't force it on them, and we won't. It's a decision that they have to make. I think you're right. There's a lot of people out there that are abusing, that are substance abusers, and then they are doing a lot of damage. But, you know, to get it to come into our program, you know, basically right now everything is word of mouth. What we need is we would like to see another facility. We would like to get another facility to where we can house about maybe 20 to 24 men, you know, and again, you know, I want to emphasize, you know, women too. There's a lot of women out there that are, you know, out there on the streets, and we need to get them in recovery. You know, recovery works. It does. I'm a prime example. Okay, like I said, I've been clean sober now for, you know, a little over 7 years, and to be able to turn my life around and run this program and give back and see a lot of people out there, you know, doing the same thing that I used to do, you know, and feel I'm blessed, you know, totally blessed. And like I said, treatment works, recovery works, and if we could, you know, get people into treatment, if we have more resources, like I said, a detox center where they can, you know, go into detox and then transition into the program. You know, I think it'll work. I really do. You know, but again, you can't force them. You know, they're gonna have to want it.
This wasn't my question, but
I would encourage you.
it wasn't my question. But it comes with a lot of complexity. One of the things is we have to start seeing all of ourselves as part of the problem. I mean, we all live in this community. We all either work for an organization or a system or some sort of systemic problem that contributes to what's going on in our communities. And we can also use those same avenues to promote the good work and the good health for these individuals in our communities. It's not just individuals with substance abuse problems that's hyping up the crime. I mean, there's a lot of individuals in our communities that contribute to the crime that's going on. So my input to your question is we need multiple touch points for these individuals. It's not just his program, it's not just the hospital, it's not just the schools, it's not just what Lisa does, but before an individual hit my bottom, first of all, I don't feel like a person should have to hit my bottom in order for them to get services that they need. That's what we're trying to save them from, or try to reach out to them before that happens. But we never know when a person is going to make that decision to move forward and work whatever program it is that they're trying to work. So because we don't know that, it may be one individual that they listen to, it may be the 25th, it may be the 100th individual that finally got through to them. That's why we're here. We need multiple touch points. We need multiple avenues. We need multiple individuals going back and reaching out to them in the community versus us sitting around expecting those individuals to come to us. It's not going to happen. It will happen for some that are really ready to, but we also have to be the ones that's providing them with multiple ways to be touched, to be talked to. Medanos said they forget waiting on everybody else, they took it upon themselves. Those are the types of programs that we need. That's the type of community networking that we need in order to look at this problem differently.
Oh, it's your turn, sorry.
Valentino, I want to follow up a little bit on you were speaking at the end of the line, homeless situation has increased with bars being completed. What those numbers look like. Also, I'm sure you have repeat people coming back into the hospital consistently. And then lastly, how does this affect, costs at the hospital in regards to, percentages of money that they're going towards, responding to this problem?
So as far as the first question, how BART is playing its role, I don't personally have any specific numbers as far as how many of the patients that we see at our hospital are coming from other counties. But like I said earlier, we are starting to track these numbers and to track this data. So at some point, I'm hoping that we'll be able to have kind of an approximate number. But we definitely have seen growth in those scenarios where a person was either on BART and it was the last stop, or maybe they were on BART intoxicated or some other type of behavior, and they were forced off of the BART, and therefore 911 got involved. They had some sort of medical issue. They bring them directly over to the hospital. Typically, I'm able to recognize when a patient is from a different county just by them telling me that they're homeless and they have a certain type of insurance. I mean, that's how frequent, this happens. All I need is those two indicators, and I know that they came from a different county other than Contra Costa. The work to get them back home safely is that much more difficult because, one, they don't have a community or friends or family that they can go to or that they feel safe going to in this particular county. They definitely want to get home, but if they have some sort of medical issue, then you have to play the medical game, the healthcare game, which falls under finances and a lot of other things that kind of counterbalance the good work that we're trying to do. And then lastly, figuring out, how do we get these individuals back to whatever their community is. Sometimes it may be a taxi route, right? That definitely doesn't come cheap. If we have bus passes, if we have BART passes, we do a lot of work with Tri-Delta as well. So those are some of the issues that we run into. We're trying to connect them to another medical respite or shelter in a different county. So not only are we trying to get them there safely, but it's that much more yellow tape that you have to go through in order to figure out how to do that. The next question was
Fiscal impact.
the fiscal impact. So yes, we see multiple high utilizers is the term that we use, which means some individuals frequent the emergency room often. And there's a certain metric that the healthcare looks at. You look at readmissions and how much cost is associated to that. The cost is easily into the hundreds of thousands to millions of patients cycling through the emergency room or inpatient, only to be discharged to a suboptimal placement within the community because we just don't have enough resources for long-term housing for these individuals. So we do the best that we can, but maybe the patient has a wound. Maybe the patient needs some sort of physical therapy. Whatever the health implication is, they typically don't have the best recovery because they don't have a stable environment. So you get half the recovery, and a lot of times they end up back into the hospital before they ever had the ability to fully recover. So those are a lot of the issues that we see. Again, like I mentioned earlier, we have one medical respite here in Concord, which every hospital is using. So if I have 5 different hospitals fighting over the same bed, and we all have a patient each, only one of those patients is getting that benefit. Right? You know, and a lot of times we have more than just one patient, we have multiple patients, but only one of them is going to get the male bed, one is going to get the female bed. And they do as much as they can. I mean, Philip Norm is working wonders for our hospital systems, but their capacity is constantly at a max because we have to have other infrastructures in place other than this one facility.
So my question, so we heard from a lot of panelists, and you just pointed out something that caught my attention. With Ron Martin and Terry House earlier, they talked about that they know and go to every people someone's background. And then you're talking about people who are coming in and out of the hospital. And then our chief of police and our code enforcement division, and I've seen this firsthand, are kind of dealing with the same people on our street. So some may end up back at the hospital because someone called the fire department, someone who's discharged, something may happen, or they may end up back because they got in a fight with the police called, or the fire department came. So is it fair, and I could be wrong, is it fair to say that this is a kind of finite number of people who are utilizing all these different services, from the county to the fire department to Sutter Health to, and I in particular, so yeah, it's a finite number of people who are utilizing the same services over and over.
So when you're looking at hospital resources or fire department or whatever it is, that patient that keeps coming back to the emergency room, there are two groups, and both of these groups, which is a relatively small number to the rest of the patient population that we serve, these two groups do make up a large portion of the finances that your county spends. So within the homeless patient population, that is a true statement. There's a small number that makes up a large percentage of the services that's being provided. You have patients that aren't homeless that have the same dynamic as well. Your statement is true, but it does come from two subsets. You have individuals that have housing, that the same cycle is happening, and then you have individuals who are homeless, in which the same cycle is happening. One interesting thing that I just learned probably a month ago is that the city of Antioch, it was this Medicare group that did this study. They run numbers, and they were looking at the demographics for the city of Antioch. And basically what they said is that you guys are at a disadvantage in the sense of the amount of resources that you have to utilize on your patient population. We have a very high number of Medicaid patients, Medicare and Medicaid. So what that means is you either have a very high number of elderly patients or individuals that meet the Medicare requirements, yet they're under the poverty level, which means they qualify for Medicaid. So they're elderly and they don't have the financial support. But then we also in the same community have a very high number of younger individuals who don't meet the Medicare standards based off of their age, but yet they meet Medicare guidelines because they're so clinically debilitated, either from a physical standpoint or mental health. So they qualify for Medicare at 30, 40 years of age, what our patient population looks like. So we not only have a poor elderly patient population, but we also have a younger population that's extremely sick, either physically or from the standpoint of mental health.
All right, any other questions? Maybe last question.
So my question is, what about the homeless that have chronic health conditions like diabetes, heart failure, and things of that nature that need require follow-up care? What have you guys handle those kinds of situations?
So again, and that was another thing that I mentioned earlier. That's another very difficult area, right? So a lot of those patients do need skilled nursing facilities. So one of the things that we've done, we put together a SNF collaborative to have our local SNFs in the area that to work with our patient population and have an agreement that they will be willing to accept these patients, and then on the back end, we work with Philip Medical Rescue so that these patients will have a safer transition when they're discharged from skilled nursing facilities. I've also done work with Steve Sutter over at the Bark Clinic so that we can provide these same types of resources to our patients on methadone maintenance to help them get into skilled nursing facilities or services back into the community and still be able to access their daily regimen or whatever it is that they need from the Bark Clinic, because that was a very sensitive area in our particular county. As far as follow-up, we're doing a lot of work with Contra Costa Health Plan. Fortunately for us, a lot of our homeless patients and families are connected with CCHP. So we now work with them monthly to raise awareness, and of course they got the Whole Person Connect or Community Connect that have a case management group providing services to those patients as well. Right now we're still trying to figure out the best way to work collaboratively. Everyone is trying to do the work, but it's still fragmented. So what we're trying to work on is how do we do this work and not reinvent the wheel? How do we all know and own the families and patients that's living in our community so that instead of 10 phone calls, I can make one phone call, right? How do we have those single point of contacts? And then the other thing is really trying to connect them with follow-up back to their primary care physicians. And then how do you get them there, right? How do they access transportation? How do you make sure that they have access to their medications when they go to the pharmacy? We have a program through Sutter that we created, which is the Bay Area Transitions Team, and we do a lot of referrals to them. So once that patient is discharged, they'll do a lot of the outpatient work that my department isn't able to do anymore because the patient isn't there. So I don't have the complete answer for you, but there are several different programs in our community. Whole Person Connect. You have the core team that's doing a ton of work. You have those and a lot of things that we're doing. I would love to be brought to partner with to hear about more of our youth, because we get a small number, and I usually don't know what to do with those families. So right now, everyone is kind of in the growing pains of figuring out how to do this in an effective way, an efficient way, but we definitely are working on it.
Wondering if LMC and AOC are also taking advantage of that in helping our students and youth connect when it comes to healthcare. Are you able to?
Oh, yeah, we'll do it. All right. But I appreciate that. Round of applause to our panelists. Thank you. And also, I didn't introduce, we have a representative from Assembly Member Jim Fraser's office is here today. Please remind me of your name again.
My name is Sean.
Hello, Sean. So thank you for being here, and we appreciate the Assembly members' interest in this topic.
I just want to thank the extraordinary work that's going on in these organizations. You know, Lisa and Anthony, Valentino, Cecilia, that, you've taken it upon yourself to try to look at, this gap of meeting the needs of students and homeless and shelters and addiction services. So I just want to personally thank you for the work you're doing, and hopefully out of what we're doing, that we can become better at this and have that one call that somebody makes to be able to get services to somebody at much quicker than, all of us striking out individually. So thanks again.
I'm sorry, I think we forgot to ask our question. If you have one recommendation you can make about this growing crisis for COVID, and then we'll close it out.
I think through it all, just patience, both with the people as well as the organizations, because like I know, right, and we're all working to make it happen, one day at a time.
I think,
recommendation in terms of policy. What do we need to do as a city?
so as far as the city, definitely creating a smaller, like more intimate setting of these various programs that you brought through this panel so far, and start there. And a lot of the problem is I don't know how another program works, or what they can accept, or what patient population they're exactly working with. If I send a patient out of the hospital with 30 different numbers, I might as well have told them to go Google something, right? So we need to understand what each other is doing, and then from there we can start formulating a streamlined process that connects to whatever services. So a lot of great things going on, but if it's fragmented, it doesn't work. So that's what I would recommend.
What I would recommend is, and of course, I'm going to stand on this, basically treatment facility. I mean, it doesn't all the other programs that this panel is doing is great, but the fact of the matter is, kind of getting back on your question to him, that is something that we are trying to prevent, people hitting rock bottom. The fact of the matter is, there's people out there that are at rock bottom, and they are homeless because of substance abuse, and I believe that with treatment and the right education, we can get through it.
For me, it's very easy. We need a shelter in Antioch, at least one. I know we're getting a warming center, but it's at least a year or two away. And I know it's been in the works for a while. Money's there, just finding a location. It's really difficult when our families have to go over the hill and then get their kids to school and back. And that's just adding another huge burden to get kids. And, we don't advocate for them to have to move their kids around to a lot of different schools. That's partly what the community that they'll have in place for, is that the kids can stay at the school that their school origin, regardless of where they're living. So that's number one. I hate to hear when the families are out in Concord or San Ramon, wherever they have to go because that's the only place they can find a shelter. And especially the unaccompanied. If I had my way in, I could go to school district,